Hello, my name is Incy Muir. I'm the Executive Director of the Farmington Valley Visiting Nurse Association, and joining me today is Sandee Fleet, our Community Liaison. In this confusing, rapidly changing healthcare environment, do you or any of your loved ones ever feel that you're getting lost in this healthcare system? Or do you feel that you have less and less to say about how your care is being delivered? Our program today is geared towards this important topic, being your own healthcare advocate. Although this really could be a 3-hour program, Sandee and I would like to touch upon some of the key questions and points regarding the current healthcare system, trends that we are seeing and hearing about from our community residents, and to provide simple tips to help you advocate for yourself or your family members. Before we start talking about being a healthcare advocate, I just want to tell you a little bit about our organization as some background. The Farmington Valley VNA has been in the community since 1908. We're very proud of our long history. We are still independent, freestanding, and not associated with a large healthcare system or a hospital. We've delivered services to our communities for so long and have touched many people's lives here in the community. Many of you probably know someone who has been served by or cared for by the Farmington Valley VNA. We are a licensed Medicare certified home health agency and hospice, and we also have, as part of our mission, community health and wellness programming to provide our clinics, our health screenings, educational programming, school health nursing, and a food bank program in Granby. So we've been here a long time, and we are very pleased to be able to share some of our knowledge with you today. We really can't talk about being your own healthcare advocate without touching a little bit upon healthcare reform. And again, this is a huge topic today, and I don't think anyone really understands fully what that means. We are still evaluating as well what healthcare reform may mean to us and to our community residents in the future. But what we do know is that healthcare reform is here to stay. It is law. And we know that the focus of healthcare reform really is to contain cost and also improve quality of care. But how that is going to happen is still very unclear. The Medicare program, as many of us know, is an area where we are trying to reduce cost to avoid bankruptcy of the Medicare system. And that translates into the delivery of health services under the Medicare program. We're hearing about the new models of healthcare reform. What, again, may that look like? We're hearing things in the news pertaining to healthcare exchanges. How might we be purchasing healthcare in the future? How that may affect employers and their employees, and also the new concept of accountable care organizations, or ACOs. Again, I don't think there's anyone who hasn't seen or read about one or more of these things in the newspapers or, again, the local news programs. And we still just don't know what they really mean. We know that the hospital systems and physicians groups in the area and nationally are beginning to create ACOs, or these accountable care organizations, with the model being that there be a central place for funding, and then that central entity, whether it be a hospital, a physician practice, or whomever, will then distribute those funds in the delivery of a comprehensive healthcare program. We know that our local hospitals here in the Hartford area and actually several physician groups have already successfully become ACOs, and they are still beginning to formulate what that system is going to look like. A real basis to this concept is also a network of preferred providers. We also know that from the news, a lot of the delivery of health care is being looked at. We're hearing about and reading that many health screenings that have normally been, again, almost accepted are now being questioned in terms of frequency, efficiency. Do they actually help reduce mortality? And again, those are all big questions that I don't think any of us can answer today. Part of healthcare reform also has affected the hospital systems in that they have a penalty now imposed upon them if an individual goes home and then goes back into the hospital as a readmission within 30 days. There are penalties being imposed upon hospitals if individuals are readmitted back into the hospital because of some care issues. So everyone really is focused on how do we keep people home, healthy, keep them out of the hospital, and keep healthcare costs down. I know Sandee, as our community liaison, is out in the community doing a lot of educational programming and networking with groups throughout our community. And I'd like to maybe turn it over to you, Sandee, and ask you, what are you hearing about healthcare reform? What are the concerns you're hearing?
Well, you're absolutely right, Incy. People are very concerned. They're concerned about when they go to their doctor, are they asking the right questions? And I think many times they'll say, well, I'm going to check the website. I'm going to find out more about what is going on with myself. And I think that whether it be their family that helps them go to the website or whether they just read more, I think they're much more informed patients. And I do try to emphasize it's important. Go to the doctor, take your list. Be ready. He's going to give you the time if you have the list, or she. So I say, take your list. No question is a dumb question. It's got to be something that you really need to know to be informed about what your situation is and what alternatives that you have. I tell folks, know what vaccines you've had. When was the last time you had a checkup? When did you have any blood work? And all of that information is your right to have. So if you don't have a list of that, ask your doctor. Those kind of things are important, and you should have a folder at home with that kind of information in.
I think we're definitely seeing the trend that not only individuals who we serve, who we call our patients and clients, but also the family members and the children are very much becoming more educated, informed.
Absolutely.
They want to know. We are dealing with populations now that are, again, much, I don't want to say more astute, but they're much more concerned about being informed and knowing the facts than perhaps we've seen in the past. So this whole topic of healthcare advocacy is timely. And of all people, I think we at the Farmington Valley VNA, and certainly myself as a nurse, and also a caregiver on a personal basis, and having had family and friends who've needed health care, I mean we all have, that advocacy for one's own health is critical because it's so easy for us to get lost in these big systems. We've all had stories where we've just gotten lost. We don't know really what's going on. The communication sometimes between physicians and healthcare providers and the patients and families is very difficult at times. So we have to ask those questions.
Exactly. And I think also it's very important that if you don't understand, or if you have a language or a hearing problem, take that healthcare advocate with you to the doctor. And make sure that you're hearing the same as your healthcare proxy, for instance, is hearing, so that you can talk about that with a family member. Lots of people say, oh, I'm too embarrassed to take somebody. Do take someone that has your interest, because the next step may be they have to speak for you.
Correct. And we're also encouraging that even though it may seem odd or uncomfortable, to prepare a list of questions before any appointment. Because once you're there, before sitting across the desk or on an exam table from a physician or healthcare provider, you forget. Or you may be nervous and not remember. Again, that happens to all of us. So bring a list. It is not uncommon. You should be doing that. And again, it's part of being informed and being sure that you don't leave that office until you get the answers to your questions.
And don't mind. I mean, please repeat the question. If you haven't understood it, say, I really don't understand. Could you tell me in a different way? They're more than willing to do that. And the nurse can be helpful too.
Absolutely. And again, I think part of that fundamental concept is informed consent. Again, anyone who's been in the hospital or has undergone a procedure or surgery is always asked to sign a consent form, and it's supposed to be an informed consent. It's all part of the same topic.
Right.
So there is intrinsically a right and a need for individuals to know about their health care, know what is transpiring in their health care, and feeling free and comfortable to ask the questions that they need so that they are informed. We talk a lot about the fact that there are so many choices, there's so many things going on, and that all we really want to stress with our community is be an informed consumer. We're all informed consumers when we buy our appliances, when we go to the bank,
cars.
That's right, we do a lot of research. It is the same, if not more important, quite honestly, to do that
And
in the
there's so many
healthcare.
sites, so many websites today that we can go to find that information.
Right. And the other thing, too, that I want to mention is, as part of this, is people often are reluctant to seek second opinions.
So
Again, it's an
important.
uncomfortable situation at times to be asking or informing your physician that you may want to get a second opinion, but it really is something that if you feel you are not sure or feel you want to get just another evaluation by a healthcare provider, it is your right and you should do so. Again, I cannot tell you how many times, just in terms of our own experiences at the VNA, that the outcomes sometimes have been very different. And then at least you have more information. And I think we are all not comfortable saying to our doctor, well, I do want to have another opinion. But honestly, in today's environment, there should be no physician or healthcare provider that becomes angry because of that. They should understand and respect that right of individuals to seek a second opinion. And again, sometimes that second opinion can really open up different avenues and options for people that could be less invasive, could be completely different from the first opinion, or at least, if nothing else, give additional information. So we stress that, and I think that's critical for the community also to feel comfortable with. And also requesting copies of medical records. Maybe at times that could be overwhelming, and sometimes people don't even want to get copies of their medical records, but often, again, we hear people who say, I had blood work and I didn't know what the result was, or I had this type of test and I have no idea what the result was and didn't hear anything. Well, it's people's right to request a copy.
And especially if they travel.
Correct.
If they spend some time in a different location for the winter, they should have those things at hand and with the doctor's phone numbers and fax numbers and all of that, just so they can advocate for themselves should they be in a hospital or in a rehab situation.
Right. Right. I think one area of particular concern that we've been seeing more of through the Farmington Valley VNA is that patients' rights and the individual's right to choose their health care provider is becoming more and more of a concern in the healthcare environment. Patients' rights it's not new, because the ensuring of patients' rights has been, again, embedded in regulation and the healthcare delivery system for years. We, as a home health agency and hospice program, have got all kinds of paperwork and forms and things that we have got to provide to assure that patients' rights are valued and respected and carried through. But we are finding in our line of work, especially now, in this thrust of healthcare reform, the uncertainty, all the changes that are going on in the environment, that the individual's right to choose their provider is getting lost. And it's a growing concern for us. And we are hearing more and more about that from our community residents and families, where either, number one, they do not know that they have the right to choose their healthcare provider.
Right, and that's so important.
Or if they do have a choice, that it is not being honored. And again, I know when you're out in the community, you've had some specific examples where you've heard about this from people.
Absolutely, absolutely. And you know, you need to specifically name us or whoever you really feel the most comfortable about naming the facility or the group that you want to work with. You just can't say, for instance, in our situation, the VNA. You have to say the Farmington Valley VNA.
Right.
And I try to give people a card. If they say, well, I want you when I have to have some help at home. Well, I give them a card that says Farmington Valley VNA, simply because they forget. If they're on medication or they're confused in a situation, they can say, well, you know, this is who I really want. And if you let the social worker know, or the hospital discharge planner, or their family, just letting your family know that I would really like to have the people that I had the last time, the Farmington Valley VNA. It's a very easy situation for them to be able to get who they want when they want the person.
Right.
And it's so important for you to tell your sister or tell your daughter, now remember, if I need to go and have help, please ask them to make sure. Because sometimes they just get a list, if they get a list at all.
Right.
And they don't know who to pick. They just say, well, I want the VNA. But you have to, it's like Kleenex. We say Kleenex instead of tissues, and then all of a sudden that's a brand name.
Right.
So we want to be as the Farmington Valley VNA.
Well, and especially too because in this environment, so many organizations have changed names or they've merged. We're seeing national entry into Connecticut and even into the Farmington Valley of organizations that are national franchises for home health and hospice. And people don't know the difference. They can't be expected to know the difference unless, again, we tell people and at least inform them that there are differences. And if individuals choose to have a specific provider, then they should name that provider so that they can be sure that their wishes are carried through. I mean, we would love everyone to be calling us, but if someone has a particular choice with another provider, that's their choice. We respect that. I think the real sad thing is when we hear from our patients and families that they expected us to be the provider and another agency comes to their door. And it was just because of what you said. It was the VNA. And VNA may not even be a visiting nurse association. It could be a home health agency, which is not a historic, nonprofit organization.
And then it becomes embarrassing to the patient. Well, you're not the group I wanted, or gee, I thought so-and-so was coming. So it eliminates a lot of confusion if they do the naming. And it doesn't have to be us that they name if they're familiar with another group, but we certainly hope it'll be us.
Right. Well, and I think that from my perspective, again, I've been with the agency now almost 24 years, and I'm a nurse and have been in home health since graduating from nursing school. But I think that the real concerning thing is that patient's choice it's embedded in the law. It's not new, and it's always been there, and it was respected and carried through much more consistently in the past. We are now in a very competitive environment. We're in turmoil. Things are really happening very quickly, and that's getting lost. But it is fundamentally embedded in the law in a number of different places. It's in state statute and federal statute. It is part of the Balanced Budget Act of 1997, and also it is a fundamental part of the Medicare conditions of participation, which hospitals and other Medicare providers are bound to follow in order to be a Medicare provider. So it's embedded in the law, and if patient choice is not honored, and if it's actually not carried through specifically, those providers are violating the law, and also, in my own opinion, not providing ethical care.
Or choices.
I mean, it's really a legal and also an ethical issue, and we actually see a number of different articles and publications that are being put out today by healthcare experts. And one individual who we use as a resource is Elizabeth Hogue. She's an attorney who specializes in healthcare. She has written a number of articles on this specific topic, patient choice and the provider's obligation to give patients choice, and specifically how that has to happen. It's very, very clear that how that should be done, right down to the specifics of a discharge planner or any individual who's planning the discharge of an individual from one location to the next, that they give choice. It has to be a written list. It has, if there is a relationship between the provider and the hospital, that has to be disclosed. They cannot in any way indicate that they have a preference or imply that one agency is better than the other,
Right.
or that
That's
perhaps the
correct.
discharge planning process and paperwork process might go more smoothly if they choose X agency. Those are all things that are against the law.
Right, it's called steering.
Right.
And they really need to be very open-minded
Right.
about giving free choice to the patient.
And we've, as you know, we've taken, I think, a much more aggressive position on this in the past year, and really most recently, because we are seeing a lot of evidence of that. We are seeing
We have.
more and more very specific examples of systems, hospitals, and providers that are steering patients to a specific agency because of a financial or other kind of a relationship. We're seeing it.
Right, right.
It is not anything that we are just assuming. We are seeing evidence of that. We're hearing the feedback. We're documenting all of that. So we've taken, as you know, a very
Right.
strong approach to trying to educate people about this and to be sure that they know that this is their right and that it is the legal obligation of hospitals, nursing homes, rehab facilities, and physicians to give choice and to not steer patients to a place where they may not choose to go.
No.
If individuals cannot make a choice, or if they ask for assistance, that's perfectly fine, because we know people get very confused and they are stressed at a time
may
of
not
illness.
have family
but
members
it
to
still
pitch
cannot
in.
be something that makes the individual feel that they have to choose a specific provider. The physician does have some rights, however, as they should, because the physician does order a plan of care and the services that individuals have. But they would really have to indicate why they are referring or recommending a specific organization. And usually, if they do not honor the patient's choice, it has to be because the physician has a tangible reason to believe that the quality of care is not where he or she would like it to be, because they do drive the plan of care for individuals. So there are some exceptions, but they're
Right.
narrow. But we've taken that very, very aggressive approach to trying to educate people about this topic and how to perhaps assure that they are carrying through their own wishes and choosing the provider that
Absolutely.
they choose.
Well, I'd like to share with the folks our newsletter, which is the Farmington Valley Visiting Nurse Association newsletter that we put out every few months. And this particular month is the March edition, and you have a choice, and it's the law. So if you haven't subscribed or haven't sent your name in, please give us a call, because we'd very much like for you to read the entire article. I think it's very well written, and it talks about knowing your choice. So again, this is not the website, but this is the newsletter.
Right.
So if you would like to read about this, please give us a call. Our number is right here. And just be put on our mailing list. And maybe you could address this article here too.
Yeah, I certainly will. We're going to save the best for last.
Oh, okay.
But just to add to what Sandee just said, that this newsletter is also on our website, and our website address is www.farmingtonvalleyvna.org. Very simple, long, but but it's clear.
Right.
And if you would like to receive a copy of our newsletter, we'd be happy to put you on our list. You can certainly call us, 860-651-3539. We'd be happy to add you to our mailing list. And yes, I know we only have a few moments left,
Right.
but I just want to end on one note. And again, we can't end a session by the VNA without doing a little bit of bragging. But I think this is something that
think so,
we
too.
really do want the community to know, that we were designated as a 2012 Home Care Elite organization. We were given that designation very late in the fall of 2012 for this year. Basically, it is a objective designation that was bestowed upon us by the National Research Corporation and Decision Health. They take all publicly available data on all home health agencies throughout the United States, and then they compile the top 500 and top 100. The Farmington Valley VNA was in the top 100 home health agencies nationally, and even nicer, in Connecticut, we were one of only 3 that were in the top 100. The other 2 agencies are not anywhere in the greater Hartford area, so we're very, very proud of that. And that designation was given to us based upon data that measured our quality care outcomes, our quality improvement, patient experience, and financial performance. So we're very proud of that. We're a small agency, we're nonprofit, and we do so much with very little, and we still are in the top 100 nationally of all home health agencies. So I think our community can be assured that we do a great job. We are very, very committed to quality care and our community residents, and we are looking forward to being here for the next 100 years.
Absolutely.
And we actually plan to do probably some follow-up sessions to this, because this is such a big topic, and we've only touched upon smaller points. If you, as our community residents, would like to hear about anything more specifically or have questions, again, feel free to call me, call our agency at any time, and we would be happy to address those. So Sandee, anything else you'd like to add?
I'd like to just say that I have a program called Be Your Own Health Advocate. I'm glad to do it for communities. I'm glad to do it for churches. I'm glad to do it for any civic groups, because I think it's so important that we help folks get the most out of their medical care.
Absolutely. So hopefully some of our residents will take advantage. So we will see you again. Thank you for joining us, and we hope that this has been helpful for you.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.